let's move on. We have a packed agenda for you, and I'm glad to be able to introduce as our first speaker your Minister for Children and Elderly. So we have quite a lot of Swedish government presence here today. Now is your chance to put another minister on the spot and ask us some questions, probing questions. Please put your hands together to welcome Maria Larsson. Very nice to meet you.
Ladies and gentlemen, fantastic to be here. And it's a great honor and privilege for me to be here today. This is really an inspiring mix of people from different sectors, different countries, and at different ages. The fact that you are gathered here to discuss the issue of global health today does indeed point to the fact that this is everybody's business. As we all know, globalization has both positive and negative consequences to our health. We must find ways to counter the negative effects and strengthen the positive ones. We need to base our actions, of course, and measures on scientific knowledge and evidence. In this sense, research, like the one conducted as part of your project, is crucial and help us to fill information gaps and deepens our understanding. As a Minister for Children, I'm aware of the obligations according to the Convention of the Rights of the Child. Last week, the government in Sweden decided to make a thorough investigation about the consequences of incorporating the convention into Swedish law. I'm very happy for that. One obligation, according to the convention, is to offer children the highest attainable standard of health. You are central partners for decision makers like me in finding solutions of how to do that. I would like to take a few minutes to see what current evidence and trends tell us about global health today. Firstly, we should remind ourselves that we live longer and healthier lives than ever before. And that innovation, vaccines, and IT offers great, huge potential also in the future. Furthermore, we have vast knowledge about things like underlying risk factors, about the need for health promotion, as well as an increased awareness of the links between health and other sectors. We also have more knowledge today about health outcomes than we ever had before. In Sweden, we are increasingly working with public and open reporting of results and benchmarking. By focusing on the needs of the individual instead of the system, we are, I hope, creating a more efficient healthcare. However, I can see a lot of challenges ahead as well. And a couple of them are close to my work as responsible for children and the elderly. The first challenge I want to mention is the global health gains have not been evenly distributed, not between countries and not within countries. Avoidable health challenges still exist. In some cases, they are even growing. This was recently demonstrated in the European Health Report from WHO Euro. A second challenge concerns the population in marginalized or vulnerable situations. In many cases, they do not have access to health information and services they need. and they are more likely to have a worse health than the population in general. MDGs 4 and 5 about reduced child mortality and improve maternal health target two such groups. But progress is too slow, especially for maternal health. In 2010, there was still an estimated 287,000 maternal deaths. We have the knowledge, we have the technology to avoid maternal deaths. There are no excuses for not applying them. Another challenge is that all health systems will increasingly have to manage disability. More people will live more years with disabilities. It's fantastic. But this has been pointed out by the Global Burden of Disease study, and therefore the work within the UN about how to realize and broaden the Millennium Development Goals post-2015 are both timely and very important. Turning to the discussion of non-communicable diseases, we know that they are the leading global cause of death today. They are causing more deaths than all other causes combined, and they strike hardest at the population who have a low or middle income. WHO has concluded, and listen carefully to this, WHO has concluded that every 10% increase in NCDs means that the annual economic growth decreases 0.5%. So, there are both human and societal costs to disease. There are very clear challenge. Then a very clear challenge is how we can motivate people to a healthier lifestyle. If we can do that, and if we can prevent unhealthy habits, we can reduce the total burden of disease and enhance the quality of life and save resources. See, we are well aware of the challenges. We have good evidence of what kind of impact they have on our health and on our societies. To a large extent, we also know what we need to do to overcome these challenges. Then why is it so difficult to apply this knowledge and make decisions today which have good long-term effects? Why do we not act in accordance with our knowledge? One reason is probably that the consequences of our actions, both positive and negative, are too distant. We tend to concentrate on problems which seems to be more concrete. Problems which we feel that we can actually influence. Problems in our everyday life. Nevertheless, the challenges I outlined here are, and they will even be more in the future, be a part of our everyday life. Therefore, I think we must take our starting point in the individual and in her needs, as well as her capacity and driving forces. We must find ways to bridge the distance between what we know is right to do but difficult to achieve and what is possible to do right here and now. Unhealthy lifestyles are a good example. We have health-promoting methods based on scientific research, but yet the problem increases all over the world. Here, the individual's responsibilities also need to be supported by an effective collaboration between public, private, and civil society actors. In this respect, I would like to highlight our new Swedish national guidelines for methods of preventing disease. I think they are word unique. They give recommendations for preventing disease by supporting patients in their efforts to change unhealthy lifestyle related to tobacco, harmful use of alcohol, lack of physical activity, unhealthy eating habits. The healthcare professions are to provide patients with knowledge, with tools and support for improving their health, starting from the patient's own experience and motivation. Together, we can encourage healthy lifestyles and give the individual support to make smart health choices. Ladies and gentlemen, with this word, I wish you a fruitful conference and all the luck in your important work to achieve a better global health. Thank you.
Thank you so much, Minister.
Thank you.